The subject I'm going to be talking to you about today is arthritis. If you're not one of the millions of people who suffer, I'm talking about millions and millions of people who suffer from it, there's a strong likelihood that sometime in your life you're going to develop an achy joint, chronic pain, whether it's in your back or your neck, a hip or knee. The symptoms of arthritis, meaning inflammation of joints, are ubiquitous. Eventually the wear and tear of life affects all of us. For many people though, the pain and the limitations of movement are so severe that they need treatment. And conventionally they go to physicians and other practitioners who prescribe medications after they themselves maybe take over-the-counter medications for years and years and years. There are many cons of that, which is the chronic side effects of medications, even over-the-counter. The first tier of medications often used are anti-inflammatories. Classic is aspirin, but there are over-the-counter medications like Advil, Aleve, ibuprofen, naproxen that are useful. They relieve pain and actually some of the inflammation. But over time they wear out. Physicians then will prescribe more significant medications, often narcotics, which have a plethora of other side effects, including addiction. Beyond medications are procedures that are invasive, complicated by things like infection and further debility. There are new treatments, injections of other things to try to get the joints to heal, but none of these approaches right now are completely satisfying to most people. In fact, they deal with a certain amount of chronic pain and it's frustrating. The slow medicine approach does two things. One, it helps all people, even people before they have significant symptoms of arthritis, prevent more of the same. The anti-inflammatory life that I talk about, meaning dealing with your body's inflammation, but the mental, emotional inflammation of difficult relationships, pent-up feelings like anger and frustration, chronic fear and anxiety. These all lead the body to inflammation. And just the way we move so quickly through life and the stress and the demands on our physical bodies will grind us down. We can prevent some of those effects by learning to live in greater balance, in harmony with the cycles and rhythms of the natural world, meaning going to bed at a better hour, moving on a more regular basis, moving and doing activities chosen by the season instead of the same thing 12 months of the year. These are all ways that one could improve the quality of their bodies and their joints in particular. The other thing to consider is how one can activate the parasympathetic nervous system, the slow system, the deep breath that stimulates the vagus nerve and turns off the fight or flight, which has its chronic debilitating effects that I've spoken about many times. You can modify your diet, eat more vegetables and whole foods and less processed foods, less sugars, artificial foods, less inflammatory animal products. That shift in and of itself can have profound impact on not only your future, but the immediate symptoms that you may be experiencing now. You can also reduce the tension in your life by finding a true calling, living your life with passion and purpose, trying to make more time for the things that you enjoy, the play, the people, the natural world. All these things contribute to not only what happens in your body over time, but how it feels now, and ultimately the quality of your life. Some of the symptoms of arthritis are subjective. When somebody's aggravated, irritated, not well rested, their symptoms the next day may be greater. It's not that the inflammation in their body specifically, or the destruction of the joints specifically, is so much greater than it was the day before, but the acute layer of an aggravating day and a poor night's sleep makes a big difference. So imagine what it would be like if you could get on top of that and find more ways to control and discipline yourself and to live a life with greater ease. Not to do more work, but to find a way to live in balance. One of the problems with arthritis is the limitations of movement, not just the pain. And while stretching and toning and certain activities can improve us physically, think about how you could expand your thought process, your mind, and stretch your opinions, stretch your relationships, stretch other aspects of your life, not just the physical body, because in truth, the mind and body are connected. And when you do things that stretch your mentality, then in fact your body finds greater flexibility in that. Lastly, as I say many times, don't do this on your own. Find a community that supports you. Find people who will take a walk with you, who will sit and stretch your body and your mind. Connect to us here at slowmedicinedoctor.com and find other ways to get involved in the slow medicine community. You can call me at any time, 914-218-3113, or connect with me by sending me a note, michael@slowmedicinedoctor.com. Subscribe to our monthly newsletter, which we call a Moonletter, and I'll tell you more about arthritis and other conditions that you and other people that you care about might be interested in. And as always, I wish you well. This is not always the easiest thing to do, but one that has a great payoff, and just a little change can make a big difference.